Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Dr. Prasad Katta. Dr. Katta graduated from the University of Gulbarga, India. He completed his residency in medicine in Great Britain and obtained the degree of Member of Royal College of Physicians. He conducted his residency in internal medicine at the University of Medicine and Dentistry of New Jersey in 2002. And a fellowship in endocrinology from Charles R. Drew University at UCLA in 2004. Dr. Katta is board certified in internal medicine and endocrinology. His interests include diabetes, thyroid, and osteoporosis.
The topic today which was given to me was diabetes ups and downs, troubleshooting high and low blood sugar levels. So that's the theme of the topic. So I've kept it pretty simple, so I've not used too many medical names or names of medications, things like that. This is what I discuss with pretty much every of my patient who comes and sees me for diabetes, if they're taking oral medications or insulin, doesn't matter. Pretty much day in and day out stuff, I would say. But some things are probably more specific. If they go on new medications that can increase the blood sugar, so on and so forth, but I'll talk to you about that in more detail. Okay, so let's start off. So what's diabetes? It's a hormonal disease. Basically, you've seen this slide before if you watched Comcast channel 78, which results in high levels of blood glucose, resulting from both insulin not being produced properly from the organ called pancreas, or the action of insulin which acts on the cells to take up glucose, that action is not proper, or a combination of both. And it does result, if you don't control diabetes, it does result in some complications including your eyes, your kidneys, your nerves, and some of the other complications are with respect to a stroke. With respect to heart disease, it's still debatable, but we can say that at least with respect to circulation in the toes and things like that, you can have problems with that. So that's what diabetes is. And there are two types. Type 2 is the more common one. 95% of the patients have type 2 diabetes. And majority of my patients, about 65% of my patients each month I see is with type 2 diabetes. And it's again, as I said, is a combination of insulin deficiency, where insulin is not produced enough, and also resistance of insulin, where insulin is not, though it's produced, it's not being utilized properly to take care of the blood sugars or use of the blood sugars by the cells. It's no longer a disease of the adults. If you see, previously we used to think 20, 30 years ago, we always used to think diabetes, yeah, someone should be 40, 50, 60 years or more. But I've seen patients who are 8, 7, 5-year-old kids when I was training. This was about 10 years ago, 11 years ago, as I said. I came here 11 years ago. At that time itself, I used to see patients who are 5, 6, 7 years old who are type 2 diabetes. So we used to ask them to swallow pills, not take injections, because most of the time when we say kids having diabetes, it's type 1 diabetes where they have to take injections. So these kids were actually were taking oral medications. And the other thing is, definitely there is a link with obesity, okay? And as we know, overweight, obesity, at least 66% of the normal population whether they have diabetes or not in United States, have obesity or overweight problems. So that definitely is a link with diabetes. Then there's also a genetic link. And again, as I discussed earlier, highs and lows blood sugar can be a problem for various reasons in these kind of patients too, in type 2 diabetes. It's not only related to type 1, but it's also can be in type 2. So the second type of diabetes is the type 1 diabetes, which is about 5 to 10% of the population. And again, here insulin is absolutely required. If you don't have insulin, they cannot live. Probably they'll end up in the hospital if they don't take the insulin for maybe, depending upon how they are, maybe half a day, 3/4 of a day, at the most a day, then they'll definitely have complications and they'll end up in the hospital. It's usually autoimmune. What that means is a lot of times the body produces some antibodies which actually fights against the cells producing insulin in their own body. So that's what is called autoimmune. And highs and lows here can be more common than type 2 and more of a problem than type 2. The reason being, these patients do not have any insulin at all. So if they take a little more insulin, 1 or 2 units, they can go low. If they take 1 or 2 units less or eat a bigger meal, they can go high. So that's very much a problem in type 1 diabetes. So I wanted to put this slide together to at least to make you understand insulin is the most important hormone with respect to type 2 diabetes. But there are other hormones too which play some role. And these are the ones which I've sort of put this in this tabular column here. One is insulin that's produced by the pancreas. It decreases blood sugar. Glucagon produced by the pancreas increases blood sugar. Cortisol, this is, you've probably heard of this. This is produced by the adrenal gland. The adrenal gland sits on top of the kidney. It's like a hat-shaped gland. I'll show you a little bit later. And that actually increases blood sugar. So where does cortisol, what happens to cortisol? Yes, if we are stressed, cortisol can go up. If we are, because stress can be positive or negative, it can go up. Adrenaline and noradrenaline, this is also produced by the adrenal gland, and this also increases blood sugar. Let's say for whatever reason we are going to miss our train and we have to catch it within 3 minutes, and you probably think it'll be 5 minutes, and we start running. Yeah, your adrenaline, noradrenaline will raise, so will your cortisol. So then your blood sugars will go up. If someone is diabetic, definitely. So growth hormone, this is produced by the pituitary gland, which is in the center of the brain. And that also increases blood sugar, but this is usually a later effect. So this is the endocrine glands. The endocrine glands is, the endocrinology is what I practice. They call it endocrine glands because the hormones are produced in one place, but their actions are other places of the body. So that's why it's called endocrine. And the pituitary gland, as I said, is in the center of the brain. And then we have the pancreas here. The adrenal gland is here, which sits on top of the kidney. It's a hat-shaped gland. So these are the glands which we sort of give some importance to with control of the blood sugar, so on and so forth. So where's the pancreas? Pancreas is here, the liver is here, stomach, and the intestines are here. So pancreas is sitting here. So what does it do? It produces 2 different types of hormones other than other enzymes and things like that. So this is the islets of Langerhans. These are the cells which produce the insulin and another hormone called glucagon. Okay? And the pancreas is here, as I showed you even earlier. So these are the 2 cells. One is the B cells, you can say. Another is the A cells. B is for, we call beta cells. A is for alpha cells. The beta cells, it makes up about 70 to 80% of the endocrine mass of the pancreas. The beta cells are located in the central portion of the islet cells. The islet cells are the cells which produces insulin. And they produce insulin and another hormone called amylin. Okay, and actually there is another medication which reduces blood sugars along with insulin, and this is actually one of them. The insulin increased in response to elevated blood sugars, and the glucose levels are lowered because of the insulin. So that's the beta cells and the insulin, what it does to the blood sugars. So the alpha cells, it comprises about 15%, and it's located in the periphery outside of the cells. Okay, and they produce glucagon. Glucagon is actually a hormone which is produced, and it's also a medication. If someone has low blood sugars, especially in type 1 patients, you can give an injection of glucagon. I'll come to that later. and you can get their blood sugars up probably in 15 minutes to 20 minutes, pretty much easily. So they make the blood glucose, which is released in the, stored in the liver, to release it. So the glucagon is released in response to the low blood glucose level and increases the sugar levels. So what are the causes of high blood sugars? I have a lot of these here. They're pretty simple. It's common sense, you can say. Diet, time and type of food. We'll go into each one of these in a little bit more detail. Not taking medications. If you skip medications, not taking medications, which could include insulin, yes, that will result in high sugars. Timing of medications. Again, some of the medications have to be taken before food. If you eat food and say, okay, I'll take my either medications or insulin half an hour, 1 hour later, that may not work well for the body to get your blood sugars down. Sometimes what happens, you may actually have a low blood sugar later on because you've already passed the time where you're supposed to take the medication, and you're eating now and you're taking your medication later on, about half an hour to 1 hour or sometimes even later, then you can have a low blood sugar too. So high sugars initially, then it can lead to low sugars. New medications. There are definitely some new medications because so let's say people have asthma, arthritis, so on and so forth. They can go on new medications like steroids. I'll come into some of the list a little bit later called steroids. One of the examples is prednisone, which is very commonly used for asthma, arthritis, and so on and so forth. That can cause high blood sugars. Illness, any kind of illness, pneumonia, urinary tract infection, any kind of illness can cause high blood sugars. Injury or surgery. So that again, as I said, injury or surgery, I gave you an example of catching a train. Let's say think something more serious. If you have an accident and you have an injury, that again raises your cortisol, that again raises your other hormones like the adrenaline and noradrenal. So that raises your blood sugars. Stress, positive or negative, okay? So stress again increases cortisol, okay? It increases adrenaline, noradrenaline. So your blood sugars can go up. So again, positive or negative, you may say, okay, someone who's type 1 getting married, okay, it's a positive stress. So, but it still increases cortisol, it still increases noradrenaline and adrenaline. So high sugars. Negative stress, bereavement, some other examples like that, someone loses a job, definitely it can increase. A lot of my patients come and ask me, doctor, does stress increases my blood sugar? Absolutely yes. Means there is no way to quantify stress. I can't measure someone's stress. Okay, and again, someone may be saying they're stressful, but for another person that may not be that stressful. So it's difficult to measure it. So definitely yes, it can increase your blood sugars. Outdated insulin or medications, it's more common with outdated insulin, I would say. Medications, usually you have an expiry date of, means at least maybe more than a few months, maybe a year or something like that. Sometimes insulin, when you're opened and you've not used it for a few weeks, it's usually 4 weeks, 28 days. Some insulin may be up to 42 days. But you have to use it in time. That is one of the other examples for high sugars. So what's the definition of high sugar? Again, this is a sort of a moving target and depends on what organization you see or believe in. I just gave you the American Diabetes Association's, the ADA guidelines here. So if you're fasting or before eating, I've said you need to be less than 130. So if you're more than 130, you are high. Again, I'll go into some of the caveats in a little more detail here. 180 or above for 2 hours after eating, so which we call it as the postprandial sugars, after meal checking sugars 180 or above. So again, I've said it depends on the time of the day, okay? Before or after meals, again here it goes there. Age. Age is also an important thing because recently we have found there are a couple of 2 or 3 studies have come out and shown us that in older patients, okay, anyone above, let's say 65, 70, if we keep their sugars too well controlled, that also is not good for them. So we do sort of put that age into that category too. Social situation, someone who lives by themselves, let's say who's 80 years old, takes insulin 3 or 4 times a day, lives by themselves. We don't want this kind of a patient to have low sugars and go to the hospital, call 911. So for them, we can let them run a little bit more higher. It's fine. As long as we are keeping them reasonably under control is good. Other conditions, that the patient has, if they have heart disease, if they have previous history of stroke, if they have previous history of kidney disease. So in these kinds of patients, you have to be very important, and we need to keep the sugars slightly higher than what we do for normal patients. So what are the symptoms? I'll go into a little more detail. This is just a cartoon figure. So extreme tiredness, dry mouth, extreme thirst, drowsiness, frequent urge to urinate. These don't happen just overnight. Your sugar should be pretty high. They need to be about 250, 300 all the time. Just one sugar above 180 or 210, you won't have these symptoms. A lot of times high sugars, you may not have any symptoms. If they're just for a couple of days and things like that, you may not have any symptoms at all. So again, this slide basically shows the early symptoms, which is increased thirst, increased urination, blurred vision, and fatigue. And the late symptoms like fruity smell of breath, abdominal pain, nausea, vomiting, rapid breathing, weakness, confusion, and unconsciousness. These are all these symptoms here, these 4 or 5 things are more common in type 1 patients. The type 2 patients may not have these symptoms unless their sugars are more than like 500 or 800 or 1000. We have seen patients whose sugars are greater than 1000. So definitely they can have these. But in type 1 patients, they can have these symptoms even at 300, 350 or even 400. Anything like that, definitely they can have these symptoms. So high sugars and diet, again, type of diet, okay, we know carbohydrates. A lot of us do talk about carbohydrates. We can look at the packages, so on and so forth. Diet rich in carbohydrates, what are the things? Rice, pasta, potatoes, fruits, all those things have carbohydrates, and there are also some hidden carbohydrates which we may not count that also can increase high sugars. Some beverages, I put beverages here because a lot of times when you are diagnosed with type 1, type 2 diabetes, patients may not know about this, and they start, because they are thirsty, they start drinking a lot of juices. That increases their sugars even more. I've also said here even black coffee. There was a study in about 15 patients, and this was a study in type 1 diabetes patients where they only drank black coffee, no milk, no sugar. It increased their blood sugars. So that also can increase blood sugars. Time, again, as I discussed earlier, eating with respect to taking the medication, okay, whether it's oral or with insulin. So some of the medications are glimepiride, glyburide, natiglinide. All these medications should be taken at least 10-15 minutes before you eat, at least about 10 minutes before eating, because what these medications do is they send signals to the pancreas to produce insulin. So if your pancreas has started working and you start eating, that's better for you rather than if you take the medication just when you are about to start eating or after you start eating. Missing medications, again, which we discussed earlier, definitely can raise raise sugars higher. And proper techniques of administering insulin and medications, that's very important. So I will talk in the next few slides about insulin because that's very important in patients who take insulin. I have seen some patients where the technique is not proper and we have to re-educate them and so on and so forth. So this slide, I apologize for this, it's a little blurred. So you have to hold the insulin syringe straight. It's a 90-degree angle and just you go in. You don't want to go at an angle of 45 degrees. This is the correct angle, the way to hold the syringe, and then push the needle in and then push the plunger and hold it there for at least count up till 10 and then remove it. More often we use pens nowadays, and this is how the pen, again you hold it straight up, push it down and push the injection button completely upon the needle until the tick sound is heard and the dosage scale goes to 0. So there is a dosage scale here, you can't see that goes back to 0, and you count up till 10 seconds after the injection. Make sure completely dose delivery is done and do not lose the push button until you pull out the needle. So you don't want to loosen it, you keep it pressed, then only pull out the needle. Pull out the needle and finish the injection, and then you can put the cap back on and dispose the needle appropriately. So this is how insulin is administered. So the other thing which I wanted to show was this slide here. This is actually not his muscles. These are actually fat deposits here, okay, where they keep giving injections again and again. So if you're injecting in the same place for years together, the insulin absorption is not proper. So that can result in high sugars. They need more and more insulin, plus their blood sugars is not controlled. So what we are going to do, again, increase the insulin. And if the patient, if the physician, as a physician, we don't look at these sites and diagnose them, then the patient will be just taking more and more insulin, and the sugars won't be controlled. So where are the areas you usually inject? We want to do it in the abdominal area here, or the best is here. The second best is in the side of the arms, in the fatty area, or third best is in the side of the thighs. And usually I tell my patients to do, imagine an M or a W. So take the points of the M or the W, you get 5 points, and you can inject there. That's what I tell my patients. So that's the best way to do M or a W. Inject, imagine an M or a W on each side of your abdomen, and inject in those 5 points and move to the other side. That's the best way, so that you keep rotating them. So new medications, I spoke earlier about just briefly about new medications. So what are the new medications? There are actually at least another 12 of them. I didn't put all of them. I said steroids like prednisone. This is the most common one. People with asthma take it, COPD take it. They can also be used as injections. Someone has arthritis, a frozen shoulder, or a tendonitis. They can give the injections there in whichever area they have tendonitis. That can definitely raise sugars. Most of the time, the orthopedic surgeons do tell the patients about they can raise their sugars, but sometimes the patient is surprised. They may have told them, they forget it, and then they call their doctor maybe 5 days later, oh, my sugars are so high, I don't know what's happening. And then that's one of the things we'll have to go through. Antipsychotic medications. I've seen a few patients who take antipsychotic medications. They are usually pre-diabetic, but what happens is, because they do gain weight and so on and so forth, they can become diabetic, and this can be really florid. And a couple of my patients have seen their A1C being very high, okay, and when they have taken antipsychotic medications, and this happened over like a few months, like 6 to 8 months, things like that. Cyclosporin, which is used for arthritis and other rheumatological diseases, that can also increase the blood sugar. A water pill like hydrochlorothiazide, which is very commonly used, that also can increase blood sugar. Some of the HIV medications can also increase blood sugar. And many other medications, I've not put here, as I said, another 11 or 12 medications are there. I didn't list all of them. So if any new medications, you definitely want to talk to the doctor, at least the doctor who is prescribing, or at least your own doctor, to make sure if the sugars are higher, can it cause it, and so on and so forth. So illness. So again, I said illness and stress can produce produce the hormones which increase blood sugars. That's again the cortisol, the adrenal gland, the adrenaline and noradrenaline, adrenal gland, both of them increase blood sugar. Again, stress can be positive or negative, which I discussed earlier. Surgery or injury can do the same. Surgery or injury is a type of trauma or illness, pretty much, and it's sort of controlled type of illness, you can say, the surgery. But if an injury, you don't have any control over it. But again, that's pretty much like a stress kind of a reaction, and you produce both these similar hormones, and your sugars can go up. So what are the other couple of causes? Lack of exercise. If you don't exercise, that definitely will increase your sugars, and use of outdated insulin, which I discussed earlier. Next couple of slides, I just want to show you. Last 2.5 million years, this is where we are, and now we have become this. A lot of us, and if you look at our kids or grandkids, things like that, they're not any better. All they do is play on video games, or have their iPhone or iPad, and so on and so forth. So definitely exercise plays a very important role in controlling blood sugars. And I usually ask when I give the talks, what's right or wrong about this slide? You can say there's nothing right or nothing wrong about this slide, but if you look at it, there's no one taking the steps here. Everyone is on the elevator, whether going or coming. It doesn't matter. So that's the other thing. So high sugars causes we discussed earlier. So how can we avoid it? Time and type of food. We have to make healthy choices, at least reasonably healthy choices. Know the foods which will elevate our blood sugar, and try and see if we can moderate them, avoid them if possible. Not taking medications. Again, whenever you meet the physician, make sure they explain to you at least what medication should be taken at what time and so on and so forth, before or after food. Does it make a difference? Some medications it may not make a difference, so it's okay. So, but at least as long as you know the medications which needs to be taken before you eat, that's very important. New medications, as I discussed earlier, yes, what happens if you take these new medications? Can it increase the blood sugars? Illness, we discussed injury or surgery, this we can't avoid, but at least you will have to control our blood sugars when we have it. Stress, positive or negative, definitely can increase the blood sugars, but you'll have to try and see what are the other ways to mitigate the stress and so on and so forth. Lack of exercise we discussed, and use of outdated insulin or medications. Very important is check your sugars at various times of the day. When your numbers are high, check it at various times of the day, call your doctor, talk to them, and then go from there. That's the best way to do it. Hypoglycemia. Hypoglycemia is a term used for low blood sugars. Okay, so it means low blood sugars. Exact level, again, it depends. We don't have an exact definition of where, okay, is it 50, 60, 70? Usually they say it's 70 to call it as hypoglycemia. But a lot of patients who have high sugars, initially when we treat them, they can feel that they are low even when they're 100, 110, 120. I have a few patients who come to me and tell, I feel very jittery, very anxious, I feel hungry when I'm 100, 110. So we have to accept that. We have to just step back a little bit, so that may be normal for you, and so on and so forth. But if they're very early on in the diagnosis, then we need to encourage the patient, look, that's because your sugars have been high. That's why your body feels like that. Give it a little bit more time and you'll become better, and you can probably tolerate the sugars of 90 or 80. So that's what you have to know about hypoglycemia. So what are the symptoms? Early symptoms are shaking, sweating, rapid heartbeat, change in vision, hungry, headache, sudden moodiness. See, some of the symptoms, if you look at it, very similar to high blood sugars. Hungry, headache, sudden moodiness, all these are some of the symptoms which you have high blood sugars too. Yeah, when patient comes and tells me, I know how my sugars are when they are high, it's actually they've done more than a few studies on this. It's not, you cannot really correlate that way. You can say you know, but sometimes if you look at it, okay, check when you feel you're high and check when you feel you're low, a lot of times you'll be wrong. So that's what you want to understand, that it can be, some of the symptoms can be similar to high and low blood sugars. Late symptoms are behavioral change, lack of coordination, inattention, confusion, and seizures. We don't want ever patients to go into this. Yes, if you are on medications and insulin, yes, you probably will have hypoglycemia, but you have to be educated and you should prevent it as much as possible. So this is again a cartoon figure. Headachy, hungry, confused, dizzy, grumpy, shaky, and sweaty. So these are all the symptoms which the patient can have. So what are the common causes of hypoglycemia? Most common is missing meals. Some patients say I only eat 2 meals, that's all, but I can't eat a third meal, or I eat very little of a third meal. But if they're taking medications which can cause low blood sugars, then it's a problem. So you have to probably eat something in between, even a small snack or something which can keep your sugars in between the meals normal, not go low. Overdose of medications or insulin, that's again a fairly important cause. Exercise, unplanned exercise, that's one of the things. So if you have taken insulin, let's say you were not going to plan to exercise, but you just went out and you started jogging, or you had to do some other extra work at home which was physical, that can result in low blood sugars. Alcohol, again, this alcohol itself may not result in low blood sugars, but alcohol without eating meals and taking your medications, those are very important causes for low blood sugars too. Kidney and liver failure, if someone has kidney functioning which is worsened and they're taking their normal medications, that can also cause low blood sugars. Medications which can cause hypoglycemia, we know insulin definitely can. Glyburide, glipizide, and glimepiride, these are medications, as I suggested earlier, which act on the pancreas to produce more insulin. Definitely they can cause low blood sugars. And this, the natiglinide and ripaglinide, can also cause low blood sugars. These are medications similar to this, but they are shorter acting. They only work for about maybe 2 to 4 hours. But still they're acting on the pancreas to produce more insulin. So definitely they can cause low blood sugars too. Other medications, when they're used in combination with these, they can definitely cause low blood sugars. So most of the other medications you can say they may not cause, but when you're used in combination with any of these, they can cause low sugars. I just wanted to show this. So this is the liver. Okay, these are the liver cells. So what happens in hypoglycemia? High or excess insulin. So this is the liver. The liver usually produces glucose. Because there is more insulin, that shuts that production of glucose off. So there's decreased glucose production from the liver. So what happens in the fat tissue and also the muscles? Usually, if there is not much insulin, if there is if there is an amount of insulin which is adequate for the body, they take up glucose. So if you have too much insulin, okay, so they take up a lot of glucose, so there's not much in the bloodstream. So what happens is, so low blood sugars in your bloodstream, so that's why you have all the symptoms. More glucose is taken up by both the fat cells and also the muscle cells. So that's what happens. So what we need to do then is to take in more glucose and get it to a normal level. Again, we spoke about this earlier, so we need to know about the pituitary gland, we need to know about the adrenal gland which sit on top of the kidneys, and we need to know about the pancreas here. Why do we need to know about it? So because of the hormonal factors which sort of contribute to the hypoglycemia or help take care of the hypoglycemia. The hormones, adrenaline and noradrenaline, which is secreted by the adrenal gland, it actually increases and raises the blood sugars when the blood sugars are low. The glucagon, which is a hormone produced by the pancreas, also rapidly increases the blood sugars. And the cortisol, produced by the adrenal gland, this is a late response. It's not immediate, but it's late. And the growth hormone, which is produced by the pituitary gland, also increases the blood sugars, but it's a late or delayed response. What happens when a patient has blood sugars? This is especially in type 1 patients, but can also happen in type 2 patients if they are on insulin and they have repeated episodes of low blood sugars. Then what happens is, what sugars they were feeling at 70 or 80, they start feeling at 60. What sugars they're feeling at 60, they start only feeling at 50 or 40. That's very, very bad for the patient and also the physician. Okay? The reason being, if you don't know when your sugars are low, then it's a problem. Okay? Actually, some patients think that's good. No, it's not good. It's definitely not good. You need to feel your sugars when you are around 70, 80, and so you can take care of it. And unfortunately, if you have had diabetes for a long time, this is a problem for a lot of patients. So when patients have repeated low blood sugars, the counter-regulatory hormones, which I showed you here, these are the counter-regulatory hormones, okay, which raises the blood sugars. Whether early or delayed response does not matter. So which are supposed to get released get delayed. What was happening in a few minutes, they may take half an hour, 45 minutes to get released. So that's the problem. The patient may not feel the low blood sugars at all, and this could lead to a patient coming to know about low blood sugars very late, or even they can be in coma. So that's very important. So especially in type 1 patients, we do see this happen. So what we do is back off on the insulin. Even if their control is not adequate, it's fine, but back off on the insulin, and then again reassess the patient in a few weeks to months, and then they get their responses back, but it may not be exactly the same way when 10 or 15 years ago. So the best treatment for hypoglycemia is to prevent an episode from occurring. You don't want the episode to happen at all. So that's the best treatment for hypoglycemia. But if it happens, the patient needs to be educated. Avoid skipping meals, to plan meals and exercise in order to avoid the episodes, avoidance of alcohol. So those are some of the things you can think about with respect to hypoglycemia, and take the medications on time. Okay, so when an episode occurs, what can you do? Access to easy sugar tablets which are available over the counter. You can go to any pharmacy and get these sugar tablets. Check your blood sugars in 15-20 minutes and repeat the dose if needed. So you take 3 or 4 of the glucose tablets, okay, and then check your blood sugars again in about 15 to 20 minutes, and then go from there. So the easy way to remember it is the 15-15-50 rule. So 2 15s and 1 50. So in 15 minutes, after taking 15 grams of carbohydrates, your blood sugar should increase by 50 points. If it doesn't, you have to repeat whatever you did earlier until it goes 50 points from the first time you checked. So I told about glucagon earlier. So this is the glucagon pen. Pretty much anyone who has type 1 diabetes or even type 2 diabetes who are on insulin and who have episodes of hypoglycemia, they should have this at their home. Okay, it has to be refrigerated. Okay, the insurance companies are becoming more and more sticky about they're charging a lot. That's what I should say. But previously it was fairly cheap, and the expiry date usually it expires in about 6 to 8 months. It's not like a year and a half long. So that's the other thing which you need to know. Sometimes most patients may not use it and it expires. That's the other problem. So use of glucagon is very important if patients are unresponsive, if they're not able to eat or drink, what you can give them. Who are on insulin and also in type 1 diabetes can be given, it has to be given as an injection. Family members should be educated about administration, how to you do it. It's pretty simple. There is a pre-filled syringe here with saline. You have to inject it into this bottle which contains the glucagon, shake it well, withdraw and inject. Intramuscular does not matter, subcutaneous does not matter, IV does not matter. So this is the way you have to do it. So pretty simple, and anyone who has type 1 diabetes or who are on insulin should know about this. So again, how often should we check the sugars? Because if you don't check the sugars, you don't know whether you're low or high. So then you can't tell your doctor whether you're low or high. Depends on what type of a diabetes a patient has, how controlled the blood sugars are, and whether you are on oral medications or on insulin. Again, it's not like a set thing that you can only check once a day or twice a day or things like that. But again, a lot of it is restricted to some extent by insurance, by what type of diabetes you have, and whether you're on insulin or not, so on and so forth. So that's what I've stated here. So once a day, blood sugars, you can, if it's type 2 diabetes on oral medications, yes. And again, Medicare guidelines, if you're on oral medications and if you are controlled, so they say pretty much you can only check once a day. If you're not controlled, yes, the doctor should write something and then you can check maybe 2 to 3 times a day. Check at different times of the day. Most of the times patients, it's like a ritual, like brushing their teeth, they want to check it in the morning. That's not the way. You have to try and do it at different times. Then you'll come to know, okay, I ate something different. I exercised here. Okay, yes, my sugars are down, my sugars are higher, so on and so forth. 2 times of the day blood sugars if you're type 2 diabetic on oral medications when not controlled, or taking insulins like 70-30, 75-25, 50-50. We don't use this that often nowadays, but I've just put it here. Again, important to check at different times of the day. That's very important. Don't want to check just in the morning or in the evening just before eating. Try and check 2 hours after eating. Try and check when you're going to bed. So 3 to 4 times or more type 2 diabetes on more than one type of insulin, like you're taking 3 or 4 shots a day. Type 1 diabetes, some of my patients check 7 to 8 times, 10 times a day. So these are type 1 patients. When the patient is on a pump, an insulin pump, which gives you the insulin, they have to check more often. When the patients are uncontrolled, yes, initially when you have the patients uncontrolled, we tell them to check 4, 5, 6 times a day, at least minimum 3 to 4 times a day. So what are the other newer concepts out there instead of checking blood sugars? But again, I shouldn't say instead of checking blood sugars, it's in addition to checking blood sugars, these are the sensors. We can put them on in patients underneath their skin in the belly. They are on the patient for about 5 to 7 days, and that gives us a reading for about 5 to 7 days, and they check their blood sugars every like 2 to 3 minutes once. On top of that, you also need to check and see whether it correlates well with the graphs. I'll show you in the next page. This is one by Medtronic, a company called Medtronic, and this is another one called a company, it's a Dexcom sensor. So glucose sensor can be used in see the trends of the sugars. I'll show why do we need to see the trends. The trend is like a movie. It's not like one still shot of a photograph. It's like a movie. So you can see when it goes up, when it comes down, when it's normal, all those things. At times, just blood sugars may not tell the full picture or the entire picture. So we need to know that. So this is the one thing which I wanted to show you. So this is the movie I was talking about. It starts here, and this is 0 hours midnight, and this ends 24 hours here. So 12 a.m. and again this is 11:59 p.m. here. Okay. So what happens? So this patient is checking. This is depicted here. This is the blood sugars here which the patient has checked. He has checked here is about 140, 150. He has checked here is 120. He has checked here is 180. And he has checked here is like probably 80 or 90. So if you look at this, when the patient gives you whether his logbook or whether you're downloading his machine, the blood sugar monitor, you think it's great. It's absolutely fine. But what happens in between scenes here? This is the scene which you don't know. So again, after lunch, this is the scene you don't know. Actually, this is after dinner. His lunch actually is pretty small. He went low here. So this is the scene you don't know. So that's why in some patients we do use these sensors off and on patients, where we can't correlate between the blood sugars and what are the numbers they are having by the blood tests or things like that, the A1C, and there's another measurement called glycomark which we do, which is a measurement of after meal blood sugars for the last 3 weeks. So this is a very important thing to know about for this patient, because he's having lows and he's also having highs. Unless we change this habit, it will go on like this forever. So that's very important. So what is the good news? The good news is it is fairly easy to manage as long as we are determined, and we have to be conscientious of what we do. So by managing the ABCs of diabetes, there are actually A, B, C, D, E, F, a lot of them are there, but I just wanted to stick with ABC for this lecture. So ABC, A stands for A1C, which we know. This is the average sugar for the last 3 months. B stands for blood pressure, and C stands for cholesterol. So A1C measures the average blood sugar over the last 3 months. So you get your A1C checked at least twice a year if your sugars are controlled. If you're not controlled, maybe 3 to 4 times a year is fine. A1C goal less than 7 for most patients, and less than 6.5 for the patients who I told you who don't have those caveats: age, other comorbidities, heart disease, do not stay alone, not taking insulin. For them, we definitely still want them to have it 6.5 or lower, as long as they're not having low sugars. So key steps or key points for lowering your A1C: eat the right foods, daily physical activity, test your blood glucose regularly, and medications as prescribed. Now for the blood pressure, you want it to be less than 130/80. High blood pressure definitely raises your risk for heart attack, stroke, eye problems, and kidney disease. And you have to get your blood pressure checked every visit, which I'm sure all the doctors do when you go in. And if it is high, you may want them to repeat it again, because it's always better, because you may have just driven there and you probably were stuck in traffic and you're high, but again you want to repeat it just before you get out of the office, so that way you know what your blood pressure is. Less than 130/80 is the goal. So how do we control the blood pressure? Eat more fruits, vegetables, reduce the amount of salt in diet, lose weight, lower alcohol intake, quit smoking by taking blood pressure medications. So a lot of times you need more than one blood pressure medication. So that is very important to know, because you may need 2, 3, 4 different medications for controlling blood pressure. And at least 30% or 30 to 40% of the patients in America need more than 3 blood pressure medications. So that's the other thing. Now check your cholesterol. So this stands for the C is for the cholesterol. Several kinds of blood fats are there. LDL is the bad cholesterol, okay, or we also call it the least desirable cholesterol. Can narrow or block the blood vessels. HDL is the good cholesterol or highly desirable cholesterol. Helps to removing the cholesterol deposits. This builds the deposits, this removes the deposits. And the triglycerides can also raise the risk for heart attack and stroke. So what are the goals we have for the control of cholesterol? LDL, we want it less than 100 in most patients, but actually if you have diabetes, there have been more than at least I would say 4 or 5 studies, big studies, which have shown that you need to be less than 70. Your risk for heart attack and stroke becomes lower. HDL cholesterol, men greater than 40, women greater than 50. Target triglycerides are less than 150. So again, how do you take key steps controlling your cholesterol? Less saturated fats. And again, one other thing is Patients come to me and tell me, okay, I don't eat much of fat, I don't eat fried food, I don't eat red meat, so on and so forth. A lot of times you don't need to eat, but your body, the liver, can produce its own cholesterol, and it does. So, and that may be more genetic than anything else. So you would want to know that. You may not be eating, but you still produce it. So then you need to take a statin then. Eat less saturated fat. Foods high in a saturated fat, fatty meats, high fat dairy products, tropical oils. Eat foods in high fiber, example oatmeal, beans, peas, citrus foods. Take cholesterol lowering medication, that's what I said as statins. There are about 8 or 9 different kinds, and most of them are generic, so which is a good thing. And exercise regularly. And again, exercise, though I'm telling you exercise, it helps for a lot of things. With respect to the cholesterol, if you're already exercising a bit and you're, let's say, just on the borderline, it only decreases your cholesterol about 10 to 15%. So someone is 125 and we want them to be 70. They won't be able to decrease their cholesterol by exercise or even diet and exercise to 70. They probably will have to be on a small dose of a medication along with the exercise. Okay. Okay, thank you. You're welcome.